Ibuprofen is a very safe drug for almost all the children who will ever take a dose or two of it. However, in some situations, it is a drug that can have unwanted side effects. The first thing to know is that both ibuprofen and Tylenol are very good drugs for what they're supposed to do, namely decrease children's fevers and also act as what we would call mild analgesic. In other words, they work pretty well for controlling the type of pain that you might expect if you had a moderate headache or you had muscle soreness after having exercised vigorously. They both also have pretty good effect on lowering your child's temperature if in fact they have a fever. Now, fevers themselves are not necessarily a bad thing. They're part of your body's defense against infection, but many times children, when they have fevers, they do have headaches or they feel unwell, they're not eating as much, and parents worry about that. So many parents are going to try and lower a child's temperature, if for no other reason than to just make them more comfortable, or they're going to use these medications in part to help treat headaches or tummy pains. In the majority of cases, using the correct dose of ibuprofen or Tylenol for your child's weight will be perfectly fine and will not have any detrimental effect on your child at all. However, ibuprofen is a little bit special because one of the ways that it works is by affecting a particular compound in your body, something called a cytokine. And the cytokine, which is a particular protein that your body makes in certain situations, in this particular situation, one of those cytokines is made by your kidneys when in fact your child is dehydrated or volume depleted. Unfortunately, there are a lot of problems that parents are often using these drugs like ibuprofen or Tylenol for. Namely, any different condition that your child may develop, for example, a lot of vomiting or a lot of diarrhea. Why are these conditions important? Well, they're important because children that vomit a lot or have a lot of diarrhea are often not able to keep up with the amount of water and salt intake that they need. In other words, they don't eat and drink very well. And if the volume that they're losing is more than the volume that they're taking into their body, then their kidneys, among all the other things they're going to do, their kidneys are going to release this special molecule or cytokine. And that release of that particular compound is there to protect your child's kidneys from seeing the effects of not enough fluid and too low a blood pressure. So the kidneys are doing the right thing when they release this compound. The problem is that if you're using ibuprofen at the very same time, because your child has a fever or because they're complaining of tummy pain and you're trying to stop that, this particular drug is going to stop your kidneys from making that compound. And although it's probably very rare, it's in exactly that situation that using too much of these drugs, in particular if you're using it day after day because your child has been sick for a number of days, it's exactly in those situations that we're not large fans of this particular drug over Tylenol. Because the exposure to this drug, ibuprofen, when your child is volume depleted, has not been eating or drinking well, has had a lot of vomiting or diarrhea, is really the one time when this drug can put your child at risk of a complication that you would not expect to see if in fact they were taking Tylenol. So I certainly support the use of ibuprofen as with Tylenol in appropriate doses for your child's weight, given at the appropriate interval from the side of the box. In other words, usually every 6 to 8 hours as a maximum for the ibuprofen. I support using it for 1 to 2 days if that's appropriate for how sick your child is. But I caution parents for using this type of drug either for more than 2 or 3 days in a row, or definitely I caution you about using this drug if your child has become volume depleted or dehydrated. And in most situations what that means is that they're no longer able to eat and drink well, and or they're having a lot of diarrhea or vomiting on a regular basis.